Hello and welcome. This is Dr. Peter Nixick, resident at the University of Wisconsin Division of Plastic and Reconstructive Surgery. We at the Poor Lab would like to thank you for watching our supplemental video on small vessel end-to-side microanastomoses, performed by Dr. Wei-Fang Zhang. This video will cover Lesson 13 of the Microsurgical Training Manual, Small Vessel End-to-Side Microanastomoses. The diameter of the recipient and donor vessel are both roughly 1 millimeter. The recipient vessel is running top to bottom vertically across the screen, and the donor vessel is coming in from the right. As seen in previous videos working with small vessels, irrigating with a small amount of saline will help keep the vessels open during the anastomosis. We recommend cutting the donor vessel at roughly a 60-degree angle, as this will decrease eddy currents and risk of thrombosis of the microanastomosis. The window in the recipient vessel is made with the standard needle technique. A bite in the recipient vessel is taken that is roughly 2/3 the diameter of the donor vessel. The micro scissors are then used perpendicular to the needle to make the window in the side of the vessel. This ensures that the arterial window is of appropriate size. To keep the vessel open, you can use a small piece of suture within the arterial window. This will make it easier to grab the free edges of the vessel wall and decrease your risk of backwalling. One important concept that is especially important in small vessel end-to-side microanastomoses is appropriate sequence of suture placement. The goal is to place sutures in such a way that does not obstruct your ability to place the subsequent suture. In this way, the first stitch is thrown in the 180-degree position in the surgeon's forehand. Then the stitch is reversed to the surgeon's backhand to take the bite in the recipient vessel. One important concept is to only throw surgeon's knots when there is tension, as throwing unnecessary surgeon's knots increases suture burden. The next stitch is then thrown in the surgeon's backhand to approximate the back wall. In this situation, if we had used the standard two-stay technique, front wall first, it would be very difficult to access the back wall. It is important to maintain even suture spacing and to travel the same distance between bites on opposing vessel walls. Once the back wall is completed, the surgeon's side 180-degree stitch is then thrown in a similar fashion to how the back wall was sewn. First with a backhand stitch, then with the forehand stitch. One sign that you selected the appropriate sequence of suture placement is that each subsequent suture should become easier than the one prior. In the same vein, the front wall of the anastomosis is now completed top to bottom in the surgeon's forehand. You can increase efficiency by taking these bites in one and running the suture. As stated in previous videos, when running microsuture, leaving the needle in place for the last stitch helps act as an anchor point and reduce suture pull-through. With the completion of the microanastomosis in the blue blood chicken thigh model, methylene blue dyed saline is then ran through the microanastomosis to examine for patency and leaks. This concludes Lesson 13 of the Microsurgical Training Manual, Small Vessel End-to-Side Microanastomosis. Thank you.